Ending O'Brien, the 27th of August 2018. Today I'm just running you through the dental equipment and tools that we have here at Hinterland Veterinary Surgery. My course code is ACM Vet 410A and my student code is 4656852246. Alright, so today we've got the light which we direct straight onto the patient for the veterinarian to have a look at. We've also got your isoflurane and your oxygen, but it's currently turned off as we don't have a patient. Got the fluid set up and we've got a non-mo breathing circuit as this patient is going to be a feline. So we've also got the spray as well as the ET tube and the shoe tie to tie in the ET tube. For the patient we have a heat mat underneath along with a towel and a puppy pad just to ensure that all the water gets soaked up. When we do have the patient, we tend to put the face downwards, therefore all the water can drain through the drain rather than down the back of the patient's throat. For PPE for the veterinarian, we have a mask just so then any excess doesn't flick up on the veterinarian. Goggles as well, so then they have a clear vision, and gloves for to make it as aseptic as possible. For tools, we have a fair few tools here at Hinterland Veterinary Surgery. We have your scissors, you've got your curved scissors as well as your forceps and your needle holders. Curved scissors are sometimes used for cutting into the gums as well as cutting the suture material. Forceps can be used for holding the suture material when suturing up the gums, and same with the grillies. We've also got just your plain forceps, and we've also got your elevators here. These three tools here, they are extraction forceps. So we've got the small one which is generally used for the felines, and then we've got the other two as well which sometimes we use them to scrape off tartar or any plaque or anything like that. So also we've got the Carmel, the curettes here as well, which is used for scraping off the excess tartar and build-up, as well as checking the teeth itself and making sure that they're nice and sturdy, and veterinarian's happy with that. When we actually do the procedures, we've also got the gag here as well, so then it can open up the patient's mouth more for the veterinarian to have a look. All the equipment lives in this tray, which is Chlorhex and water. This is just our way of keeping the tools as sterile as possible while they're in surgery. Once they have been used, we give them a good scrub with Chlorhex, and then we let them to air dry, and then we pack them away into the dental toolkit, which also has spare tools and anything that we may need in case of emergency. For over here, we have your suture material as well as your blades. We also have your IMP3, which is used for polishing. It just connects onto here. They're disposable to keep them as aseptic as possible. We've got iLube as well as your oil, which every time we use a dental or do a dental here, we put 2 drops into each just to keep it as the maintenance up as high as possible. You've also got your drill pieces, so you've got your small and your large depending on the size of the patient and also what tooth we are extracting. Over here you've got your ultrasonic scaler, which is used for scaling the teeth, taking off plaque and anything like that. You've also got your gauze swabs and your tampon here, which is good for stopping bleeds or anything like that. You've also got this piece here, which is your, it is used for taking off the drill piece, so you just slide it on and gently push it down, pushing it on and off to whether or not you want to put the drill piece on or off. So this particular machine here, this one is for your polishing. This one it produces water, so once you've finished polishing, you spray off the water so then the dental paste isn't left on the teeth. And this is your drill piece as well. At the back here we have your distilled water, and then you've got your distilled water with the solution in it to give the patient a sterile procedure. You've also got your pump down here, which is cleaned out every 2 weeks. Just sort of excess dirty water, and it's all refilled every month, every time we use the dental machine, just to make it keep the hygiene up as well as keep the maintenance going. So over here we've got the breakdown of everything in how to keep our machines nice and well maintained. So over here you've got information about the oil. You've also got information about the burrs and how to take the drill pieces on and off. You've got more information about the burrs and drill pieces. Down in here you've got some more information about that as well, and further in here you've got information about how to keep the actual pump nice and maintained. Over here you've got your dental chart, which assists in the veterinarian when they're taking out extractions and all that, so then you can accurately chart them. And yeah, that's everything to do with the dental machine.